Thank you, Mr. Chairman. This amendment has to do with the work requirements. We've discussed that extensively through the night. So what I say will come more as a summary of what we discussed. But we should remember what's at stake today. Medicaid covers more than 72 million Americans. That includes nearly 40 million children, 7 million seniors, and 15 million people with disabilities. In my district alone, Medicaid, or Medi-Cal as we call it in California, covers nearly 1 in 5 people, and across the San Diego region, that number is almost 1 in 3. Medicaid helps working families who don't get health insurance to their jobs and helps struggling rural hospitals stay afloat. Medicaid provides treatment for opioid addiction and mental health services for those who need them the most. And let's not forget, Medicaid is also the largest provider of long-term care in this country. If you have a loved one who relies on home care, if you have a grandma in a nursing home, Medicaid is there to make sure she gets the care she needs. So when Republicans propose slashing Medicaid, what does that really mean? It means seniors will be kicked out of nursing homes. It means people with disabilities will lose their independence. It means kids will miss critical doctor's visits. And we know this because we've seen it before, and we've discussed it. We look at Arkansas. When the state piloted its Medicaid work requirement, over 18,000 people lost coverage, not because they refused to work, but because they struggled to report their hours in a newly created online-only portal. The vast majority of these people had jobs. Many more were caring for disabled relatives, recovering from illness, or navigating mental health challenges. The problem is, the work requirement didn't account for all that. Local doctors and clinics felt the strain almost immediately. Physicians reported longer waits. Patients missed their follow-up appointments. Emergency rooms saw increases in uncompensated care. And it wasn't just those subject to the mandate who suffered. Everyone in the system felt the impact, including the elderly, pregnant women, children, and people with disabilities. Similar results followed when Georgia experimented with its own mandate, and the evidence is consistent. Republican policies will increase red tape and cut health care coverage for everyone, but they do not increase employment for so-called able-bodied people. Medicaid is the difference between children getting a medication they need or not. It's the difference between a working mother affording prenatal care or risking her pregnancy. It's the difference between a senior being able to stay in their home or being forced into a nursing facility. And we all believe and understand that work is valuable. It provides stability, dignity, and a path toward opportunity. I also believe deeply that every American who can work should be encouraged and supported in doing so. Time and time again, when states have made these cuts, we have not seen increases in employment. What we have seen, we've seen people lose their health coverage, more red tape for doctors, and worse health outcomes. We heard a lot of arguments today that there are exemptions for the elderly or people with disabilities, and the problem is, in practice, these exemptions are often poorly implemented and difficult to navigate, as is the bill before us. People who should qualify still lose coverage. My constituents, veterans with post-traumatic stress injury, new mothers recovering from childbirth, or people managing chronic conditions often can't make it through the reporting process in time. My colleagues will and have pointed to the bill text and say people with disabilities are clearly exempted, but tragically it takes people who are disabled almost 8 months to receive a formal determination from the Social Security Administration. So this bill would kick disabled people who have health care off their coverage today. And that's because many of them are covered by the Affordable Care Act's Medicaid expansion, which the legislation before us would gut. And even for those who do work, often in low-wage, unstable jobs, these mandates create a penalty for workers. A missed shift, a lost job, or a technical error can trigger a cascade that ends in lost coverage. That's not promoting work, it's punishing job loss. When people lose Medicaid, they don't stop getting sick, they just stop getting preventative care. They end up in the emergency room, often sicker and often at greater cost to their family and to the taxpayers. The evidence is overwhelming, and it's from experience. These policies will drastically cut Medicaid funding and take health care away from more than 13 million Americans. The short-term spending cuts we may see on our balance sheet will be outweighed by downstream costs in both dollars and American lives. We can do better than this. I encourage my colleagues to vote yes on my amendment, and I yield back.
Thank you.